Once again, welcome back to our channel Ach'z. So in this section, we are going to discuss about a comprehensive guide to prepare for your OET exam if you're planning to give on 22nd March 2025. So what are things you can expect in this video means the complete preparation guide or the prediction or the strategies and even the topics. So let's start with our section without any further delay. So the first thing is understanding OET exam structure. So as you know, OET, Occupational English Test, will assess the communication skills or the English proficiency of healthcare providers using 4 different tests: listening, reading, writing and speaking. In that, the listening 45 minutes, they will give health related audio recording and just check out whether you can understand the scenarios. Then second module reading 60 minutes, comprehending healthcare related context. Then the third module writing 45 minutes, you need to write a professional letter that may be discharge, transfer, referral and so on. And to the last module speaking 20 minutes, they will conduct a role play in healthcare setting. Now we will go in detail for the prediction and the preparation. So first we will move on with the writing module, in which many students find difficulty in that I would suggest some topics which you need to prepare with under different letter type. So let's start up. So the first category of letter is a referral letter, in that you need to prepare with referring a COPD patient to a pulmonologist, and second one, referring a diabetic patient with diabetic foot to a podiatrist. And second one is discharge letter. So in that, the first topic is discharging a post-appendectomy patient to a home care instructions. And the second one is discharging a myocardial infarction patient with lifestyle advices. And the third letter is transfer letter. In that, the topic you need to focus. So the first one is transferring an acute renal failure patient to a renal unit. And the second one is transferring a hip fracture patient to a rehabilitation unit. So I hope you understood which all are the area you need to focus towards. Now we will discuss some preparation strategy. So the first strategy is to analyze the case notes. For that, you need to identify the relevant details and organize them effectively. And the second one is structure and the clarity. For that, you need to ensure a clear, concise introduction, include all the patient history, which is very relevant, and the recommendation, and conclude everything properly. And the last one, try to practice with sample letters. For that, you need to depend on official OET websites. Now we will move on with the second module, speaking. For that, what about the prediction and the preparation strategy? So the first scenario you need to be familiar is patient education. For that, I like to recommend 2 different topics. So the first one, advising a patient with diabetic to monitor the blood sugar. And the second scenario is to educate the patient with asthma how to use inhaler. Then the second topic is lifestyle modification. In that, I will recommend 2 different scenarios again. The patient with hypertensive, and you need to recommend on diet and the lifestyle modification. And the second one is discussing the smoking cessation strategies. Coming towards the third topic, that is post-procedure care. So in that, the first scenario is instructing a patient after this minor surgery about the wound care. And the second one is advising a patient after this post-hip replacement about the mobility exercises. Now, coming towards the preparation strategy, first of all, you need to practice the real-life scenarios with a partner. So if you are under any trainer or tutor, you can just seek help from them, or else try to depend on your friends who already passed the OET exam and all, and practice different scenarios. And while communicating, you need to ensure that you are doing that effectively with using proper empathetical words. Then you are considering the patient queries and you are responding promptly to the queries with proper words. That means the vocabulary, it should be simple and clear enough. And there are so many resources in which you will get the sample role play cards. So try to practice with that. Now, coming towards the third module, listening. So what about the things you need to focus towards? Let's check out. So the area you need to focus towards is consultation extracts. So in that you need to identify the patient's concerns and also the symptoms. Then the second thing is healthcare related conversation, the short conversation between the healthcare professionals. Example like the senior and the junior staff giving instruction or advices based on anything. And the third one is presentation. That may be like any professional or healthcare related topic, like any short interview or presentations. Coming towards the preparation strategy, you need to hear some healthcare related podcasts and audios on a regular basis and try to give attention towards the key details. And along with hearing, it's not about simply hearing the audios. You need to practice note taking. Try to write down the key information quickly as soon as possible. And whenever you practice, try to depend on official OET listening resources. Now, coming towards the last module, reading. You need to focus on expeditious reading, which means quickly locating the key information from the old test. And for this C1 and C2 extracts, it's very important for a careful reading. You need to give importance towards the synonyms or the deep meaning and about the writer's opinion or the suggestion. So these all are the areas you need to focus on that. So in the preparation strategy, I would say the skimming and scanning method for all the English proficiency exam, this technique is applicable. Skim the passages and scan for the keywords. Whenever you locate the keywords, it's always better to read 2 sentences above and 2 sentences below. Then you will get a clear-cut idea and you can confirm whether your answer is correct or not. And to improve your reading skills, in case of this OET, it's better to read out some articles and journals in connection with healthcare aspects. And try to solve some sample reading on a regular basis. So practice makes you perfect. So it's always better to consider your weak area. If you find reading difficulty in the sense, don't skip your practice at least for a day. Try to continuously practice and develop your key skills. So it's very mandatory to allocate a dedicated time for each and every subtest. So if you are doing self-practice or if you are under an academy also, try to join some free practice group. In the Facebook and all, we can see so many community who are giving free materials, samples, or you can find a partner over there to practice together. You can just share your insights. And prior to your real exam, it's always recommended to take a mock test. Okay, you can just know about your capability or your weakness or which all are the area you need to focus towards if you are taking a mock test and get feedback from some experts. So while focusing on these areas, and the topics which we mentioned and follow the preparation strategy which I mentioned, definitely you can excel and you can just achieve your required band score in the real exam. So all the very best for your 22nd March 2025 exam. Try to convey your experience soon after the test, and also we will come out with the question paper discussion soon after the test. So all the very best again, and God bless you all.